My topic is on medical mobile devices. Your phone can do a numerous amount of things. What if I told you it could save lives, and not by calling 911? My idea came from a project that a team and I recently did at my previous university. Our goal was to build a device that would incorporate a web-enabled cell phone to diagnose and or treat any disease that we were interested in. We designed a phototherapy device that would help newborn babies in underdeveloped countries. Before I get into that, let me go over the problem. The idea is to help everyone who is getting very ill and losing their lives. For example, the top 13 countries have the highest mortality rate, where more than 1,700 people lose their lives per 100,000 people. Many of the people live in areas where getting to a doctor is extremely difficult. Going to see a physician is a rarity. Though many areas have implemented a community healthcare physician, they're not usually doctors, and they have very basic limited medical knowledge. They're not equipped with many tools either. As you can see, the big problem is that people are not getting the care that they need. So what can we do about it? We need engineers, health professionals, and corporations to come together to come up with ideas like the ones my class did, but with one thing in mind. Make these devices or software easy to use and effective. We need something that people who have limited knowledge and treating patients can be able to use. The target user is the community healthcare provider. We need to be able to diagnose and suggest a treatment with the software and the hardware that could be loaded and connected to the phone. We don't need to worry about the fact for lack of self-service. The software we need has to have a connection with the hospitals in the area. This allows doctors and nurses to connect with the patient and community healthcare provider. They remotely can suggest treatments and give advice and let them know if they need serious medical attention. This device should be able to do simple testing and also help diagnose. Lastly, if the device can treat a patient, it needs to be simple to use. Right now, there are some cell phone attachments that have capabilities to find heart rates, oxygen levels, and blood pressures, but they only provide vital signs for personal use. There are higher-end devices, for example, the ones that can look into your eye and help diagnose diseases, but those kind of medical equipment are for hospital use only. We need something simple and effective. We focus on being able to treat jaundice in newborns. Since jaundice is a very common occurrence in infants, this device was the perfect idea for us. Jaundice can be extremely dangerous if not treated properly. Our device didn't need to diagnose the disease since it's easy to spot. Skin turns yellow and so do the eyes. Our treatment was easy, shining blue light. So a fairly simple idea for the physical product came to mind. Make an iPhone case that has LED lights on the back. I don't want to get too much into detail, but our software had research behind it. The software would take lab-tested data of light exposure time and light intensity to figure out how long each baby would need phototherapy. The app would ask simple questions, and using the data and algorithm, it would automatically provide treatment. The app would take personal information of the patient and send it to the hospitals for doctors or nurses to look at in real time, and send back information to their healthcare provider to take further action. Now this works for the treatment, but for a diagnosis it's a lot more complicated. Much more data, programming, information needs to go into the software. For example, another team came up with the idea of using cough frequencies to determine what disease you have. They had a code and a program that would be able to analyze cough using the microphone. They needed lots of data that had to do with sound analysis and coughs in many people. What I'm trying to get at is that the software and the devices we want to build need the following: ease of use for whoever is handling the device, be able to diagnose or do preliminary tests, provide options for treatments, and lastly, be able to provide further support if needed by the hospitals or doctors. The idea of e-health isn't new, but the idea of coming up with simple medical devices using mobile phones for people to use is. Our phones right now can do a lot of things. Some phones are almost as powerful as our computers, and we can take that technology and apply it to mobile healthcare. Help diagnose disease without extensive testing and expensive hospital visits for people who cannot in these underdeveloped countries is a big deal. Medical mobile devices can be the tools to lower the number of deaths in the world.